I do oppose the legislation. I think a bad program will set health reform back. I think it'll give people initially a sense that something has been done, and it really hasn't been done. In my office, it will not simplify things. I think it will make things even more complicated than ever. And I think to have a bad bill will set us back a long time. I think it's a bad bill, and I think no bill is better than this bill. We've got to work out something better, and maybe they've got to go back to the drawing boards, accept the fact that they did the wrong thing, and reconsider.
Not only can we not support something that is guaranteed not to work, we have to oppose it, because otherwise it's false promises and perhaps waiting another 44 years until we realize that we made a mistake. I mean, before 1965, when Medicare passed, there was a lot of movement to get national health insurance for everybody, and they said, let's just do Medicare and at the state, federal level, Medicaid, and it didn't go beyond that. So it is certainly incumbent upon us to oppose something that cannot work.
I, for one, would rather wait to get a progressive model of a single-payer plan that, if we're going to be talking about fundamental changes, than any half-baked so-called Obama plan. It's just not going to work, and mostly from a financial point of view, and I have to deal with finances. I have to run government. I have to collect taxes. It's not sustainable. It's not sustainable, and that should be a concentrated point that every elected official should be focusing on. And anytime you see Harry and Louise come back and paid commercials in the millions, where in the 80s they were out to kill the Clinton plan, now all of a sudden they reappeared on daily television, and they're basically financed by big pharmacy. I say hold on to your pocketbooks and your wallet. Something's wrong if all of a sudden big pharmacy is now backing the Obama plan and spending millions and millions of dollars, not just with PAC contributions, but with daily commercials that you'll see, at least I see them in Pennsylvania.
Margaret Flowers, Physicians for National Health Program, Dr. Flowers. I come from the state of Maryland, and we have an excellent single-payer bill there. It is not, however, a reason to support the current legislation for many of the reasons that Senator Ferlo. I wanted to speak for a moment about the notion of political feasibility versus practical feasibility, because much of the reason that this legislation is being pushed through is because they thought it would be a politically feasible plan. But the reality is that practical feasibility is what wins out in the end, and whether it's going to actually address the problems that we currently have, and it is not going to address the fundamental problems that we have with people unable to get care, with people going bankrupt to pay for their medical care, and it has no inherent cost controls. Only a national single-payer program has the inherent cost controls of being allowed to globally budget for hospitals, of being able to negotiate with pharmaceutical industry and bulk purchasing of pharmaceuticals and medical devices. Is the only system that allows us to simplify our administration so that we quit wasting $1 out of every 3 healthcare dollar on paperwork and marketing and things that have nothing to do with actual healthcare. And so from a practical feasibility standpoint, the current legislation is not going to hold up. Thank you.
Just for the record, this is Katie Robbins with Healthcare Now. We, again, organized for single-payer national healthcare, and this bill falls so short. Even with something like the Kucinich Amendment, which many people in our coalition are optimistic will see state single-payer as the next step in the legislative battle, that is no reason to support the bill coming out right now. No, we will not support it.